Hello, everyone. Welcome to the seventh session of Inspired Parenting, parenting from an attachment and trauma perspective with Daphna Lender. I'm Mary Frangie, program specialist at the Trauma Research Foundation. Inspired Parenting is a free 8-part monthly series. And whether you're a parent or interact with children in other capacities, we're pretty sure you'll find this information encouraging and useful, and find Daphna's hands-on tools, a resource that you can apply right away. And it's not just about kids. This work applies to people of all ages. Today's topic is how to deal with aggression and out of control behaviors. We'll learn how to understand your own reaction to threatening or aggressive behavior, understand the underlying psychologic states underneath, learn effective techniques that can affect the frequency or duration of aggression. Volunteers, you're welcome to come on screen with Daphna to have a conversation, or you can come on as a panelist. Keep your camera off and just use the audio to talk with Daphna, ask a question, and hear back from her. To volunteer, all you have to do is raise your hand at any time and keep it raised. Please keep your questions relevant to today's topic, and please note this discussion is not a substitute for, nor does it replace professional mental health advice, diagnosis, or treatment. If you have any concerns or questions about your health, you should always consult with a physician or other healthcare professional in the mental health field. If you're watching on YouTube, please subscribe, like, and share. It tells YouTube this content is valuable and they'll show it to more people. It's now my great pleasure to introduce Daphna Lender. Family therapy expert and attachment specialist, Daphna Lender is an international trainer and supervisor for practitioners who work with children and families. She's a certified trainer and supervisor or consultant in both theraplay and dyadic developmental psychotherapy, as well as an EMDR therapist. Daphna's expertise is drawn from 25 years of working with families in many settings, at-risk after-school programs, therapeutic foster care, in-home crisis stabilization, residential care, and private practice. Daphna's style, whether as a therapist or a teacher, is combining the lighthearted with the profound by bringing a playful, intense, and passionate presence to every encounter. Daphna is the author of 2 books, Integrative Attachment Family Therapy, due out this month or next month, and the co-author of Theraplay, the Practitioner's Guide. She teaches and supervises clinicians in 15 countries and 4 languages, English, Hebrew, French, and Spanish. Daphna, we are always so grateful to have you. Thank you so much. Take it away.
Thanks so much, Mary. Hello, everyone. Hello, parents and people who are working with kids. Okay, so I want to say that this is one of my favorite topics because I feel really passionate about this topic because I've worked with so many kids who are out of control, and it's such a scary feeling for them, and it's such a scary feeling for the provider who's taking care of them. That it's just an incredibly important subject because if it goes well and you can help the child, it can be life-changing for the child. And if it keeps happening and it is bad and keeps happening, it's so terrifying and it makes you feel terrible as a parent. And so I really just feel, I identify and I want to help so much. Okay, so we're talking about, first of all, kids who are out of control or aggressive. Remember, this is a workshop always about attachment, and that's about the relationship. So we have to remember there's 2 people in this relationship, and the kid is feeling you or bouncing off of you or resonating from your vibes as well, and you from theirs. Okay, so let's just say that no matter what the kid is doing, whether it's just doing something mild like saying a mean word like you stupid, I hate you, or swearing at you, which I consider actually mild because it is just more of an expression of that they're feeling really intensely, or maybe they throw something, but it's just a pillow or a teddy bear. Whether it's that or whether they're actually coming on full on and like hitting you or hitting their sibling or something that's super dangerous. like flinging a chair or, wielding a knife. Like these are the situations that I work with. The first thing is what do you say to yourself about yourself? And what do you say about yourself to yourself about the situation? That's the relational part of this, which is that for a moment, I want you to think about when you're in an encounter with your child who's getting worked up or aggressive. Sometimes people have this feeling like, oh my God, I'm going to drown. I'm dead. I'm dying. I can't breathe. He's going to kill me. Something horrible is going to happen. And they literally, like their world goes black. And it makes you feel like either panicked or frozen. And that's normal. That's part of our nervous system's response to make us, we're going into that fight, flight, or freeze state. Okay. And while that's normal, what we have to do is we have to become aware of it. What does that mean? Take a moment when your child is acting out and beginning to act out, just like at the beginning, before it gets more, full-blown aggression or tantrum. Do you have a sense that like your chest is heavy or constricted? Do you have like feelings of butterflies in your stomach? Or do you have some sort of tingling in your shoulders? What do you have heat that rises? So you have to notice that. Okay. The next thing is when noticing that, you need to tell yourself, this is a nervous system response and it's normal. And it doesn't mean that it's hopeless or that I'm a horrible parent or that he's going to kill me. That he's going to end up in jail. Whatever are the panic thoughts, you have to say, this is a nervous system response and it's normal and it's okay. And then you have to say something compassionate to yourself or reassuring to yourself. Like you have to be your own good friend and confident friend. You have to be able to say to yourself, I can show up. I can get through this. I can help. I can stay steady. Something that gives you a sense that there's another side of you who still has an anchor or is grounded in the possibility that this could turn out okay, and that just you like showing up is good enough. Okay. And I want to make sure that everybody understands that the first step has to be you noticing how your body reacts, becoming more sort of in tune and sensitive to that overwhelmed feeling or the heat or whatever the feeling is, and saying a message of self-compassion to yourself so that you can, the next thing you need to do is you're going to have to be able to notice and relax your body a little bit. Because what happens is when the kid is looking at you and you're looking really either really frozen because you've got like deer in the headlights look, or you're getting like a really intense look like that. Okay. They are reverberating off of that. So our social engagement system really matters. And we're only able to use our social engagement system, which is our social engagement system means our voice, our facial expressions, our gesture, our postures, and our eye contact. We want to use those to the best capacity. We want to use those to influence the child to calm down sooner and to feel more safe sooner. And so we need to be able to use our social engagement system, which you can only do if you've done the first two steps that I was telling you about just now. Because here's the social engagement system in action. You have to notice that if you're frozen in your body, you have to get a little bit of movement in your body. A lot of times when the kid is getting worked up, we freeze and we look like very intensely, like either we're deer in the headlights or we look really angry, like that. Okay. Like that very, very, don't you dare do that kind of situation. Instead, I want you to set your shoulders back. This is literally mechanical things that I want you to do. You're not going to feel like you want to do it. You have to do it anyway. Your shoulders go like this, set them back. turn a little bit to the side so that you're not forward facing, because when you're doing like forward facing like that, it's more intimidating. So turn a little bit to the side. Tilt your neck a little bit so that you have a little bit more openness to show like I'm not closed off to you. This shows vulnerability. And then it's better to, when your child is getting worked up, it is better to have some mobility in your body. And what that means is I'd like you to be able to possibly like be standing up, but not looming over the child. So give them some space, but be standing up because you're going to need to be able to react and protect yourself. Okay. So if you're sitting down and you're, especially if you're like lower than the child, you could be in a position where they're going to like hit you. And we want to prevent them from you getting hurt. And mostly, of course, I don't want you to get hurt, but it's also because when a child is able to hurt their parent, they feel like the world is really an unsafe place because my parent is supposed to be able to keep herself safe. And so if I can hurt her, I've done the worst thing that I could possibly do. So that's why I'd like you to be able to, just kind of just kind of get up casually. You don't have to, you're not start getting up like that. And I'm going to get up right now and just show you what I mean is that having some mobility in your body means that just like have some movement back and forth. I'm making very small rocking motion with my heel and having some mobility so that I'm not like a frozen like statue, and also so that I can be responsive in case something's coming at me. And I also want to have my elbows like this because I need to protect my personal space. Okay. And that's really important to prevent a kid coming at me. I need to have my arms out like this. Okay. So you have tools to create some space around you. And I want you to be able to do that. And if a kid is coming at you, you try to make their arm kind of like more like this or turn them around. So you're not grabbing them. You're just trying to more kind of move them and move with their energy rather than trying to grab them. Okay. So those are some things that I want you to be aware of how you're standing and how, and you're going to become aware that you need to have movement in your body and be able to sort of stand if you need to, but make sure you're not like crouching over them or something like that. The other thing is where the face is involved is having movement in your face, like being able to raise your eyebrows and say, hey, you know what? It's okay. We'll get through this. I'm not mad at you. You're not a bad kid. This is going to be over soon. Like being able to reassure with your words, but also with your face. Your face has to have movement because that helps to let the child know my parent isn't frozen and not afraid of me. And she is attuned to me. So having some amount of like movement in your eyebrows or making your eyes bigger and then like changing your head position is important. So those are just some of the things that I want you to really notice and practice from your point of view. This is what you can do. Okay. So now let's talk about what are aggressive and out of control behaviors. There's a whole range. There's a whole, just an incredible gamut of what people consider aggressive and out of control. The first thing I want you to remember is that most kids, I would say, 98% of the kids, and I'm willing to like I believe this really strongly. They're not being aggressive on purpose, even though it looks like they're doing it on purpose. They're doing it because they are overwhelmed. They have sensory issues. They're feeling ashamed and not good about themselves, or they feel like it's impulsive response, like ADHD. Like let's say they kick, or they push somebody away, or they bump into somebody, or they throw something. That is like a regulation issue. And so it's really important how a parent or the adult conceptualizes the behavior. Because if a kid like that has always been told, like, no, don't be unkind, don't, that's not nice. Like you're being, you're being aggressive or you're being mean. That is what the child internalizes. And the tone is also really important. And so it's really important to notice how you're characterizing or labeling the behavior. So if a kid throws something or kicks, what you want to do is say something like, oh, wow, this, you know what, you need some space, or this is really exciting, or it's like really overstimulating, or you're getting overexcited. I got you. And it's okay. You can have some space. And give them some space to, like, don't come towards them and try to kind of take things away from them or like loom over them. You just have to talk with your voice to calm them down and to characterize it that, they're really upset, and that makes sense. And you're getting overexcited, but that's okay. We'll get through this. So it's more reassuring and more focusing on the like dysregulation aspect. If a kid is throwing something at another kid or hitting, yeah, you would have to grab their arm or, block them from hitting the other child and say, firmly hold their hand and say, no hurts. I'm not going to hurt you and I'm not going to let you hurt me. But you have to have those words that come out confidently, and you do need to stop them. But the message is, just very, very matter of fact, and it's very, very relational. No hurts. I'm not going to hurt you, and I'm not going to let you hurt me or your brother. Okay. And then you immediately say, this is what you can do. We're going to move into another room. One of the things that's really important is when kids are feeling out of control, they feel like it's never going to end and that everybody's looking at them and they feel totally persecuted. So try to get all the other people, like the kids, maybe the other kids or like the other adults, if you have grandparents around, try to get them out. You need to tell them ahead of time. If I tell you to go in another room, you need to go, so that they don't have an audience. And then give them the opportunity to hide or go in another space where they can't be seen. So like maybe you can create like a closet, someplace where you can empty the closet and give them a space where they can be in their own quiet space. Or give them a blanket or pillow so that they can hide and make a tent. Because when a kid is really dysregulated and you're looking at them and talking to them, they feel really overstimulated. So they need to be able to hide. So think of it as fight, flight, freeze. Well, you don't want them to fight and you don't want them to freeze, because freeze is not going to get you anywhere. If they get completely like dissociative and withdrawn, that's not good either. So they need to be able to hide, and they want to auto-regulate instead of they don't want a hug from you. They don't want your help right now, but you can get them something to drink. You can get them some ice to chew on. You can give them a teddy bear to hold on to. You can get them to just something that they can do with their hands. Just stay with them and get just your presence is regulating. But you don't have to talk to them, because that's sometimes really overstimulating. And then once they might calm down a little bit, then you can maybe read them a story or go for a walk outside or open a window, or like just to get the air pressure and temperature different. Because when a kid is in this they're locked into this temper tantrum or whatever, this dysregulation or this aggression, the only thing that helps at that time is like lowering the stimulation and the threat level, and then sensory things like, air pressure or temperature change. That's a sensory thing. Drinking something cold, sucking and swallowing. So using a straw to drink, or listening to music, or getting in the shower, things like that. So if you think of it from the point of view of more fight, flight, freeze, that's better. And it's more dysregulation. You're going to help the child to conceptualize it more that it's not that he's a bad kid, okay, and that it's that he's doing it on purpose, and that really, really makes a difference. Now, once he's calmed down, I really recommend that you don't go over all the things that happened and say, look, you're not allowed to hit. Now what should you have done? Why didn't you do this? Why didn't you talk to me or get help? That whole lecture part is not a good thing to do right after they calm down. You have to let them several hours or even the next day, because the reset takes 20 minutes, but that's only the initial reset. Their nervous system is still really freaked out because they still feel like they're a really bad kid. They're trying to get back into the fold. So invite them back to do something cooperative with you, whatever, making dinner together or taking a walk or walking the dog or going for a ride. And if you need to talk to them about what happened and giving consequences, you would do that matter-of-factly later on after a couple hours or the next day. So those are just some ideas. I want to see in a little while, I'm going to ask if people have specific questions. And you can raise your hand to be a panel. You'll be promoted to panelist so that you can turn on your audio. If you want to turn on your video, that's fine too. I'm happy. I just like being able to have more of a back and forth instead of questions in the chat are fine, but usually people have very specific questions, but they're not able to ask them, if I can't ask clarifying questions. Okay, so let me just say a couple of more things. It makes a really big difference if the kid is throwing a pillow or a kid is throwing a teddy bear versus something that's like a book or a knife or something like that, or a chair. Okay. What if they're throwing just a teddy bear or something like that? I wouldn't say no, we don't throw things. Don't say that. I think you would just say more like, I got you. You know what? It's okay. I got you. It's more reassuring things. Okay. If they are throwing big things or kicking or something like that, the most important thing is to get the other children out of the way and other people and be able to put limits, but without using moral language and without threats. So here's what I would say. I would say, you cannot throw the chair around, but throw the furniture, but you can go in the tent area and hide, and I'll get you a drink. And it's going to get better after that. And the kid might scream, shut up, or no, it won't, or, they might scream at you and swear at you and say, F you or whatever. And you say, I got you. And it's going to be better soon. You could say you're not in trouble. I'm not mad at you. You might be mad at them, but what they're most afraid of is that they're going to get everybody hates them. They are really, really frightened that they've destroyed, that's like a scorched earth mentality. They feel like they've destroyed everything. So it is really important to say reassuring things. So don't say things. When I say threats, I mean people who might say if you keep doing that, you're not going to be able to go outside for playtime. At that point, they don't care about that. So anytime you say a consequence, that they're just going to blow it up even further. It's for them, it's Armageddon. So nothing you're going to say is going to be helpful. So the best thing to say are things that are reassuring. Imagine, what would you say to a person who, let's say you were on a bike trail and you were riding your bike and somebody fell and they broke their arm and they already called the paramedics, so they're on their way. What would you say to the person who's in pain? You would say, I got you. I'll stay with you. You're okay. You're very courageous. We're going to get through this together. That's what you would say. And that's actually what they need at that time. Now, people are saying, yeah, that's good, but they're hitting me and I'm being like literally abused every day. That's so hard. You can only do this for a little while. After a while, you don't have it in you anymore, and you do go catatonic yourself, or you're just like, fine, whatever, like you yourself. So that's a signal to you that you are really overwhelmed and that you shouldn't be with this kid alone all the time. You need another helper, and you need to be able to swap out, especially if a kid is having a big tantrum. You need to be able to swap out every like 10 minutes or so. And if you're not in a position where somebody can help you, you need to think of resources, how you can get help. Or what other arrangements, these have to be more like structural arrangements. Like if you can only take care of one kid at a time because this kid is so demanding, then maybe the other children have to go with their grandparents or to aftercare or something like that. But here's my point. It is not reasonable and it is not possible for one person to absorb all of this negative energy all the time and get this kind of out of control, very fear-inducing behavior. If you're the only person who's dealing with it, after a while, your nervous system is going to get overwhelmed. Okay, especially if you yourself were yelled at as a child, or you went through domestic violence, or you're a trauma survivor, it makes it all the harder. So we really need time to recover yourself. Okay, and really, when you go through that, then you almost need like the recovery time yourself because you feel like you've been through the ringer. You really need to respect that too. Yeah. So I was wondering if people would like to go ahead and ask questions. Either you could write in the chat, or you could be brave and come on the conversation with me. And if you don't want to turn on your camera, you don't have to. So you can maybe keep the anonymity if that's a concern for you.
We have Jessica coming on.
Hey, groovy.
Good morning. Hi, Daphna.
Hey, how are ya?
I'm wonderful. So one of the questions I have in relation to this is more centered at how do we help teach adults the first two steps? What activities or suggestions might you have to help adults build their resiliency to be able to help with these de-escalation skills? Because that's where I work with foster parents and I train them. And that's where I find there to be issue is that these children have big emotions. They're tantruming. They're having their trauma be expressed physically. And I can tell people you need to do those first two steps, check in with yourself, calm down, open it up, remove people. But how do we make people flip to be able to do that? What are some things I could do to, I guess, train that component of it? Because in that moment, their bodies go into fight or flight. And so how do you train that?
Yeah. It's a good question. So, I mean, here's the thing is that the work that I do in like my program is called Integrative Attachment Family Therapy. I have at least every third session is a parent session only. And in that parent session only, we go over this exercise I use Deb Dana's autonomic ladder. So I got her flip book called the Polyvagal Flip Chart. And it's in one of my workshops of this series. Mary, which one is it? How to regulate your own reactions to your child? Will you write it in the chat?
Sure.
Number 2?
Number 5, session 5.
Number 5. So it's recorded, so you can listen to it and have parents listen to it. And then you would do that exercise with them every third session. I need them to be aware that the only thing that they can change is themselves. And to slow down this process, you have to be able to be willing to like do these exercises in session with the therapist. What are you feeling when these situations are like first evolving and just first starting out? What do you feel in your body? So you do like literally guided imagery and say, okay, imagine your child is starting to get worked up and you can see it happening. Put yourself back in that place. Like close your eyes if you have to. What are you seeing? What are you hearing? I need you to be able to touch into a little bit of what your body is feeling so that we can go through and actually like feel it, accept it, respect it, and then like say, this is what my nervous system is doing this because I'm having the real, I'm really strong reaction. It's okay. There's nothing wrong with me. Like help them to figure out, what do I say? What am I telling myself about myself or about the situation? Like, my kid is, going to get taken away from me, or I'm the worst parent in the world, or I want to kill this kid. Like, that's what I mean by what are you telling yourself about yourself? So that whole script is in that session 5. And so there's really there's no way around doing like a repeated, like revisiting this training of every couple of sessions, talking about things that happen at home, and then really experientially like slowing them down and having them go through that step by step with you. Yeah, that's the training program that I would do. Yeah.
Thanks.
So you can look at it on this series, Jessica. And I know it's so hard, friends. I know people are saying it's so hard to slow down in the moment. Any effort that a person makes to slow down in the moment and be able to catch themselves so you can be more connected is a triumph.
Thank you.
Yeah, sure, Jessica. Thank you. And I'm not looking for perfection. I'm just looking for a little bit of improvement. Yeah. Okay, good. Hi, Cynthia.
Hi. So I have an 11-year-old, and when she's mad, she'll bump into us and like nudge us with her shoulder or elbow, but it's like she doesn't recognize or understand that she's done it. I will point it out to her like really quickly afterwards, and she'll swear up and down that she didn't do it. And okay. The confusion on her face is like, I believe her that she wasn't aware of doing it in that moment.
Mm-hmm. Okay, can you say, so is she coming? She's like mad at you because you put a boundary on her and told her she couldn't go out or something like that, and then she'll like kind of ram into you?
Yeah, it'll be like a lot of time when she's coming down the stairs and I'm standing at the bottom of the stairs, and it's like, yeah, okay, it's time to come sit at the table. No, we have to eat in the kitchen, not in the living room, or, okay, you have to put your phone away now, or, usually telling her no to things she wants to continue doing, or telling her she has to do something she doesn't want to do.
And so she'll like bump into you or elbow you, and as she's passing you or something, and it kind of feels like she's like communicating like I'm mad at you, or how do you take it?
Yeah, that's my interpretation is that it's striking out in anger to kind of be like, yeah, I'm mad at you. I don't like this thing you're making me do. But then when I say, hey, can't do that, like her perception is that I'm bumping into her, or that I'm hitting her, or her dad. This will happen walking past him as well. And when we say like, no, you, like, I was standing here and you veered into me, and it's like she doesn't believe it in that moment. Okay, I got you now, and I'm familiar with this phenomenon. I just wanted to make sure I understood. Yeah. Look, whether you want to call it like from the psychological lingo that it's a non-conscious like behavior and she's like mad at you and she's doing that, or whether it is literally that she's trying to contain her self, and like physiologically she is like can't help it and is needing to push at you, it's not worth it for you to like argue about whether she did it or not. Okay, so here's what you would do. Here's what I want you to do.
you know that she is going to come by you or something where you're trying to redirect her and you're trying to get her someplace. I want you to be the one to touch her. So I want you to put your hands out and make it so that when she's walking by you, you have your shield and your protection so that it just reduces the amount of times that she is able to like come at you. I want you to be like this before comes at you. Okay. And see if you can put your hand on her shoulder or her arm and like give her like firm touch as she's moving and like so that you're kind of directing the movement. Is that something that you think is possible?
I think so. Yeah, I can do that.
Do you feel like you could just, I want you to imagine yourself being more proactive about creating the boundary and the flow around your body so that she's not coming at you and bumping into you as she's moving past you.
Okay.
I want you to have some sense of like almost like you're a ballet dancer or like a jujitsu, person where the flow of her energy, you're kind of working with it, but you have movement. Yeah. And okay. And if she does bump to you, it feels really bad. It feels yucky. And I know you want to be able to like say something about it, but it's not useful to mention it. Unfortunately, I'm sad to say.
That's okay. That helped.
Okay.
That's very helpful. Thank you.
Oh, good. Thank you.
Thanks.
Hi.
Hello, Sarah.
I guess it's a follow-up question from the previous question about supporting parents and training. I'm curious if you explore with parents if the triggers keep happening, if after lots of training, they really continue to have a hard time to put that in because there's a history. And I wonder if you sometimes, like, would you encourage a bit of an exploration about what the trigger is about and what's their life story and kind of giving them a bit of space, even though they're not the main client? It's sometimes some things that comes up in my work that I'm not sure how to sometimes balance that or how much time to spend on that, or even if going there is a safe thing to do.
I think from the point of view of attachment, the parent's attachment history is 50% of the equation. And I definitely always ask parents about their attachment history. So in my work, as what I do is in the second session after the intake, so the first session is the intake, the second session, I tell parents, we're going to talk about your own attachment history in the second session. And if there's two parents, then I need 2 hours. And I talk to them about, okay, what was it like, growing up in your house? Did you ever feel threatened? Or scared? How was discipline handled? How was it like, how were your parents? How did they respond to you when you were happy and excited or when you were feeling distressed? Because the time where a person is in like high physiological arousal, whether it's happy or whether it's distressed, the way people work with us as when we're children really just informs how we respond to our child. So those are the kind of questions that I would ask. And other things like, whether big separations that you had from your parents and or deaths, or did other people take care of you? So I do that as a just routine because I need to be able to know how that history is affecting their perception of their child. I had a mom whose dad was really like a rageaholic and was really scary. And so she learned if I stay in the background and I don't get noticed and don't speak my needs, kind of just play possum, I'll get by, and you just don't have you don't get in too much trouble or have too many needs. And then her child was born and he's got autism and he's really externalizing. He like beats her up. She was 4.5 and she had like marks all over her body of like pinches and bruises. And it was just when he's like that, she just gets really, really small and gets frozen. And then, it gets him even more frightened because his mom is like so small, so quiet. She can't handle him. And he feels scared about that.
Right.
Yeah. So when I work with people, I always say this is like 50% about you and your attachment history. And that's what we know from attachment research is our attachment patterns. They're transmitted at a really consistently high rate to our children, unless we can be aware and change ourselves from a point of awareness and compassion. So, yeah. So even if it's foster parents who think, well, I'm not the one who caused it, it's why are you focusing on me? But we have to, because there's no such thing as a child. There's only a parent-child dyad. Child is not is barely like they don't know who they are unless they are seen in the eyes of the other person. So it's a two-person equation.
Right. Oh, I love it is empowering me to be more confident about bringing that up with parents and not shying away from doing that. Thank you so much. It's very helpful. Thank you.
Very good.
So we have a few questions in the chat, and one relates to the conversation you just had. Joanna is wondering why you can't mention to the 11-year-old that she's elbowing her mom. Wouldn't that help with her self-awareness?
Well, it would if she wouldn't argue. What it causes, from what I understood, is an argument, right? You're like, hey, did you notice you just elbowed me and it's not okay? And the kid's like, no, I didn't. And the mom's like, yeah, you did. And then the kid says, no, you elbowed me. Well, I wish that I could give her more awareness, but I think I want to do it in the sense of she's dysregulated and I want the mom to be able to help the child do it less and move and flow with her, because I don't want to get into that argument. And I think it's also really angering to the parent too, where it's like, yeah, you did elbow me. And the kid's like, no, I didn't. So now what am I thinking as a parent? You're a liar. My kid is it just doesn't seem productive. So it's not in all cases, but in this case, as it was described.
That makes sense. Thank you.
Mm-hmm.
So Peter is asking for some intervention strategies when kids use media or their devices to hide or shield their feelings.
Okay. Peter, did you say Peter?
Yes, Peter.
Because I wanted to ask Peter, I don't know what that means. I need more specifics.
Okay. Peter, if you're willing to come on, please raise your hand. You can stay off camera if you prefer. Let's see. All right. Peter is coming.
Okay, groovy. I know when people ask questions, they're actually thinking of specific children that they worked with. So it helps me to have the actual image yeah.
Peter, you can turn on your video if you're willing. And if not, you can turn on your audio and ask the question.
All right, cool. Sorry, it's a vacation day for me, but I wanted to watch this because I find it very interesting. I'm concerned with the fact that because devices are so powerful in young children, they're using them as a focus for argumentation. That they want to watch a video, they want to watch TV. I mean, they're often deflecting interventions in terms of sensitive ones, emotional ones, or tactile ones, or touching, by reverting to looking at a screen.
Okay, are you talking about a specific child in your practice or in your home or something like that?
No, I see this as
in general
theme in dealing with people. In general, we're seeing more and more people ask, how do I manage children when they're having tantrums and their response is to be staring at a screen wanting to watch a movie while they're acting up or running around. That whenever they try to engage them, they will migrate to the screen, and taking the screen away increases the intensity of their tantrums.
Right. Well, okay, got it. So it's not just the screen at the time of the tantrums or the time when you're having to talk to them about sensitive things like, hey, it's time for you to clean up your toys or put the iPad away, or why did you take your brother's whatever iPod from his room? And the kid is focused on the screen. They are tuning you out. and then they're going to, if you try to be like, hello, here, can I have your iPad? We have to shut it down. They like have a tantrum.
Right.
That kind of thing.
They're using it as a way to ignore you. I mean, to ignore people. And
so it's not, but the thing is that it isn't, it's a general phenomenon of this kid and technology where they're on their phone or on the screen, like, the majority of their day. And that's the problem. So we have to regulate, like we have to find ways and I would work with the parent to try to make it so that it's really defined the length of time that they are allowed to use their iPad. That when they're ready to get their iPad, when iPad time is needing to end, they need to be able to say to them, like come on, you have to come up to the child, you have to touch their knee and you have to touch their shoulder or something and say, you know what, now it's time for me to take your iPad. And I know you don't want to, you're going to have a really big reaction. So you want to predict it and say, I'm going to give you this instead. You're going to hold on to this. Here, hold on to this silly putty, hold on to this Play-Doh, hold on to this teddy bear. Here's your drink. Look outside. Like they need to have something else that they're doing as a replacement behavior. And you have to expect their big reaction. Let them, they're going to go through, you have to be able to weather that big reaction that they're going to have like 10 or 15 minutes of, screaming or rolling around, whatever they do, having a tantrum. You have to be able to weather that because that is the effect of screen addiction on children. And only after you get them like off of, when you practice that it gets better. And only after that are you able to talk to them about things like, that they have to whatever, do their chores or do their homework, the things that we need to get them focused on. They won't listen if they're on their screen.
I appreciate your answer. And I think that the other part that emanates from your response is that it's not a one and done. It may have to be repeated many, many times to break that cycle as an intervention. So I thank you. I'm going to tune out now and continue to listen.
Great. Thanks. Yeah, I agree with what you said, Peter. It's definitely not one and done. It's a much bigger contextual issue.
So we have a couple questions coming in through the chat. Here's one. As someone who was the target of an aggressive sibling, I often felt that the reassuring that was happening with my sibling was hard for little me to understand. Now, as someone who works with children, how do we make sure that we're supporting the aggressive child while also making sure the child who's being hurt feels that their pain and frustration is valid and that they're also important?
Oh, that's such an important perspective and so well articulated. And you know what? I fully acknowledge that it's like if you're focusing on one person and validating their reality, like you're not doing it on purpose, it's not your fault, you're not a bad kid, I'm not mad at you. And the other kid is like, hello, he's hurting me. It's so unfair what you're saying. It's like, yeah, you are having to choose who you're validating because the realities are really different. So I really want to acknowledge the hurt and the like invalidation. And for you who, the person who's putting this question out, and honor that. I think there has to be, first of all, I do think that the child who hits or hurts the other child, they need to be able to do some sort of restitution for the child who's been hurt. Maybe give them something of theirs or do something nice for them. The consequence for the child who hurts needs to be, since you hurt your sister, she doesn't want to play with you. And that's the consequence, because she's entitled. She doesn't like being hit. So afterwards, there is going to be some sort of consequence that does kind of stick up for the child who's hurt. The other thing is we often, as parents, we don't take the child who was like the victim. Usually it's the child who's like the sibling of the special needs child. We never go to therapy with them to hear out their side. And it's really important to take time, whether it's therapy or whether it's just going places by with that, the sibling of the special needs child by themselves, and hearing them out and say, like, for you, this really sucks. Like, you feel like this is totally unfair. You have different rules. You have like different expectations. We keep telling you to be like, understanding towards your sibling, but like, what about you? How is this affecting you? And even if you can't change it because you're dealing with a special needs child, you should still hear them out and say, you make sense. You really, really make sense. And I believe you. And, I'm going to try harder to see your point of view as well. Sometimes that is enough to help. Another thing, though, is if there's a child with special needs, you have to do what you can as a parent to get a babysitter or get other family members and get that kid out of the house for some length of time, once a week, once a month, sometimes, so that you're the sibling who is the one who's like absorbing all of the negative energy and doesn't get that attention, that like you can have time with them and they can just stay home and watch a movie with them or make pizza or go somewhere without having the special needs sibling like always the one getting the attention. Just make that effort to spend that one-on-one time. So that would be my recommendation. Another thing, so there's so many things that the children of special needs kids need. Like, you need to be able to be legitimized and like yelling and screaming and saying, "Get off of me!" And like, you're such a jerk. Like, the things that you want to say to your sibling, you're entitled to say.
Yeah. Thanks, Daphna. There's a few more questions that are a bit more general. Maya's asking, is there an age at which we can't improve attachment?
No, there is no age limit. There's no age limit. No age limit. You can have earned secure status. Like, you can go from having insecure attachment to secure, earned secure if you do work. Like, let's say, if your parent is now, like, so that, they were maybe a drug addict or an alcoholic or abusive, and then now they want to do repair, or you're the parent who was, misattuned or was an addict, and now you want to repair the relationship. There's small ways that you can do that. And a child always needs their parent, even when the child is a grown up. So you can change your attachment from insecure to secure. Yeah. With the help, maybe of a therapist, but this is a really big area of interest for me. So if this person wants to follow up with me, you can write me an email at daphna@daphnalender.com.
Thanks, Daphna. That's such good news.
Here's such good news. It's really helpful.
How do you, Lisa's asking, how do you make sure that the kids who are doing the aggressive behavior know that it's not okay while you're calming and supporting them? What structures help plant them internal systems of regulation and right decisions?
Well, in the moment, it doesn't matter whether they know that it's not okay. So you can tell them, hey, guess what? It's not okay to hit. I'm not going to hurt you, and I'm not going to let you hurt me. It's so much. This is all about regulation. The moral part of it comes much later in development, in terms of stages of development. And so the tricky thing is people think, oh no, this kid knows his morality and he's very smart and he knows. So he knows it's not okay to hit. But the thing is that when you're in a dysregulated state, your morals are out the window. So you can't teach them in that moment. So the only way that you can help make this better is you have to help them before their dysregulation starts by giving them by not lecturing them, by not staring at them, by not saying consequences like, if you don't stop that, we're going to not be able to go to the park. That is not helpful. So we have to get them, we have to distract them. We have to give them some place to go that's like, a quiet space. And only through that's when they're able to not have as much dysregulation, and then they're able to tune into their morals. Like they know it's not okay to hit, but they're just not able to do it at that time. So it's really like the regulation and has to come before an awareness of like, oh, I really shouldn't hit.
Great. I have two more questions. I don't know if we'll get to both of them. After the aggressive kid resets and has hours to recover, how does the adult approach having the follow-up talk?
Okay, so it's a really good question. This is how you do. Okay, first of all, it's better not to do it where you're like looking at the kid. So it's better to do it while you're walking, while you're driving, or while you're cooking or doing something together, drawing. Then you say, hey, you know what? One of the things, what I want to chat with you is that when you destroyed your brother's room, you broke this lamp or whatever, and so you have to take money out of your piggy bank to pay him back. And so you just lay it out, matter of fact, in a storytelling voice. You're not arguing, you're not questioning, you're not like interrogating. Just put it out there in a matter of fact, like whatever is the consequence. And you could say, hey, so one of the things is that when you're really upset and you get like dysregulated, then you hit your sister. And so she doesn't like to play with you anymore. And that's why, because she's really mad at you. And that's what happens. So I'm wanting to help you with it. And it's going to get better. But right now your sister doesn't want to play with you. That's why she's mad at you. Okay. And the only way it's going to get better is when she sees that that you don't hit her.
Thanks.
Okay. Mm-hmm.
We really have about 20 seconds left. I don't know if this question is much too big. Any other suggestions for de-escalating teens? They're much bigger and stronger.
Mm-hmm. De-escalating teens. Okay. Well, they sure hate talking in lectures. So I would give them some space, but I would just try to keep your own body language and your own rhythm really like, so that you're showing them that you're not angry or you're not frozen. So like do something in the kitchen that's like showing that you feel safe and open to connection. Go and bring them something to drink. Go and like just hand them something really quickly, like hand them like a pillow or hand them the dog or something like that. Or just go about like doing something. Let's say you can go like out and go for a walk or something like that. You're showing them through leadership, through doing, rather than like talking to them, because they usually teenagers, they don't want you to like talk and cajole them or lecture them, stuff like that. It's a short answer.
Helpful, so helpful. Thank you, Daphna, so much. That's all we have time for. There were a few questions missed. Hopefully we'll get to them another time. Thank you so much, Daphna. We're so grateful to you. And thanks to our volunteers. We really appreciate your questions and your vulnerability. Everyone, please join us next time for session 8, How to Validate a Child's Feelings. And all of the previous recordings are available when you sign in to your TRF account and go to My Purchased Content. Until next time, bye, everyone. Thanks so much.
Yeah, thanks, friends. Thanks for your kind words.
Bye-bye.
Ciao, ciao.